the scenario here is, one that's constantly moving. We'll get more information today as the numbers from, detected over the last 24 hours are put to us as well. New South Wales Health has been doing a very good job with contact tracing, and the community has been doing a fantastic job by staying at home. I run one of the respiratory services here in Sydney, and we are working to test as many people as possible, because unlike lots of other scenarios, when we test, we're testing for the community. So we test the individual, but we're also very clear on, if we know that we've kept cases ring-fenced to the northern beaches, then that makes policy decision-making a lot easier. Now, it's not our place to say what New South Wales Health and the New South Wales Government will do on Wednesday when they're planning to discuss further how restrictions are playing out. However, we think that New South Wales residents, for their own safety and also for the safety of those around them, should limit their movements over these next few days so that contact tracers and others can do their jobs well, because that's the best chance we have of being able to have a Christmas where we can see others.
In terms of mask wearing, it's currently highly recommended that people do. Should it now become mandatory?
So mask wearing is only part of an answer to preventing spread. So in circumstances where you can't reasonably socially distance and stay away from others, you definitely should be wearing a mask. The process for making it mandatory, that's really something that just allows us to show that we're doing the right thing rather than actually doing the right thing, because masks on their own aren't the only part of the solution. So the proposal should always be that taking, responsibility for yourself, which means, when you can't be in a scenario where you can't keep distance from others, that's when you should wear a mask, and you should always have a mask with you for those circumstances where that might play out that was unexpected, and that's sometimes in the shops, that's sometimes that's definitely on public transport. Alongside that, you should be sanitising your hands regularly, especially if you've come in contact with public or shared surfaces. It's important, if you have any respiratory symptoms, that you're going to get tested, and anyone who's been to those sites identified by New South Wales Health should be isolating and getting tested as well. So that's how we slow this down. That's how we get this under control.
You mentioned that you are treating patients at respiratory clinics, and we have seen a number of testing locations across the city dealing with an influx of people. How are they coping?
Look, they're coping well. We ask the public to be patient. The long lines that we've seen, I think, are a testament to the fact that the public are doing the right thing. They're coming forward. They're being very, very responsible because they want to look out for one another and for their families and for their elderly relatives. And that's to be congratulated and lauded. The scenario is, though, testing is taking longer at the moment. There are long lines, whether that's a drive-through clinics, pop-ups, hospital-based clinics, respiratory services, and we just ask people to be patient. Our services have really developed and evolved over the last 9 months, from a point where our testing capacity is substantial compared to where it was back in March, April, May. And that's what we want everyone to have confidence in, that there is reasonable turnaround times and the ability to get tested should you need to get tested. So remembering that it's those people with respiratory symptoms and those who have been to those locations that are listed, and ensuring that people who don't need to be tested don't go and get tested. So people who are perfectly well and have no contact with anyone else shouldn't be fronting up and putting themselves in situations where they're getting a test because they just want to be sure. There was lots of discussion over the weekend about people getting tested just so they could travel. We recommend that people are should be staying put. They shouldn't be using testing as a marker to work out whether they can get together with others. They should be following the public health guidelines and staying put.